Malaria is the #1 killer in most sub-Saharan countries, and Ghana is no exception. Every 45 minutes, a child dies of malaria in Ghana. Once upon a time in Obuasi, the situation was no different. Mine workers were spending more time in hospitals than at their posts of duty. Out of a workforce of 8,000, there were nearly 6,000 recorded cases of malaria each month. So in 2005, AngloGold Ashanti decided to actively fight malaria in Obuasi. This is what birthed the AngloGold Malaria Control Program.
AngloGold, which is the AngloGold Ashanti Malaria Control Program, has a very interesting history. In 2004, AngloGold of South Africa and Ashanti Goldfields of Ghana merged to create AngloGold Ashanti as we know it today. One of the issues that they picked up immediately after the merger was the fact that in each month, at least 6,800 people, mainly employees and their dependents, were reporting to our mine hospital. And of that 6,800, at least 2,500 were actually employees. The workforce at the time was about 8,000. So that's a bit over 30% of our workforce was reporting with cases of malaria each month.
The object of it was to make a difference, and it's utilizing an integrated malaria control program, utilizing all interventions available to us to use as tools in the fight against malaria. It was also incorporates the community around the mine.
The mainstay of this integrated intervention is the Indoor Residual Spraying (IRS) program.
We know the rainy season comes with mosquito breeding. So ideally, as per the recommendation of the World Health Organization, the insecticide is supposed to be on the wall at least 2 months before the breeding season starts, so that by the time the adult mosquitoes come out and try to infect people with the parasite, you already have the walls treated. The malaria vector is an indoor dwelling insect, so that when they come in and sit on the wall, they die.
A well thought through and carefully implemented program, it didn't take long for the effects of the IRS intervention to be felt in Obuasi. Within a short time, the results were there for all to see. Cases for people with malaria kept dropping significantly. As of December 2012, there had been drastic reduction of the number of malaria cases in Obuasi by a whopping 76%. Owing to the unquestionable success of the program in Obuasi, AngloGold decided to extend the program to other communities with focus on malaria endemic areas in the country.
We're currently operating in 5 regions. We spray in the entire Upper West region. We've almost covered Upper East region. Then we're operating in 4 districts in the Western region, 2 districts in the Central region, another 4 districts in the Ashanti region. We start spraying Northern region at the beginning of 2014. So by the end of 2015, we would have sprayed a total of 48 districts in these 5 regions.
Encouragingly, the success realized in Obuasi has been replicated in several other districts.
Economically, if mothers used to remain in the house because of their sick children, and now the children are healthy, do they have to wait? Early in the morning, especially when it was shear nuts time, they get up very early. Make sure that when it is morning, the children will get up, wash themselves and go. They don't wait for them again as used to happen.
Banwa eman die awachura nulanga ni jabele yitijenga aga asabetaka malaria la kabla vankar enga mapa.
First time tire Europe na mbani tire Europe obe spray dem wo nda minya malaria memba ko school a on fe won fa ne fie de wenya malaria edun do fine and the men kada obona na bibi dem wo spray with dem a wakada wo spray me yimi dem nzamani na mfambra pado na mbubu ntokore mo nda ho for 2 hours mo bo mo da ho no kani na pray yekodem wo bibi are very nice.
Clearly, this is a project that demands all the support it can possibly get.
I take great pride in the work that we do because I think, frankly, it is very exemplary. And I want to commend both the corporation but also the staff that manage the program on a day-to-day basis and of course the donors that make it possible for us and the host country. I think frankly it's as a flagship program, it's probably one of the best I've seen in the sector.
We therefore want to use this opportunity to invite all companies, big and small, to make their contribution towards the fight against malaria and help make Ghana a malaria-free country.
Our vision is on course to save lives. The evidence is there for all to see. No wonder Ghana says, "Thank you, Agamal."
I want to say a very big, warm thank you to Agamal.
Thank you, Agamal.
Thank you very much, Agamal.
Kudos, Agamal.
Thank you, Agamal.
Agamal.